This is the BBC.
This podcast is supported by advertising outside the UK.
This Acast podcast is sponsored by NetSuite. 36,000, the number of businesses which have upgraded to the #1 cloud financial system, NetSuite by Oracle. 25, NetSuite just turned 25. That's 25 years of helping businesses streamline their finances and reduce costs. 1, because your unique business deserves a customized solution, and that's NetSuite. Learn more when you download NetSuite's popular Key Performance Indicators checklist, absolutely free, at netsuite.com/ACAST. That's netsuite.com/ACAST.
BBC Sounds. Music, radio, podcasts.
Hello, I'm Sheila Dillon with a new edition of the food programme about something radical and simple. A fresh, minted model of healthcare, a future for the NHS, with fruit and veg on prescription. There's optimism in here, and there's not a lot of that about. So I hope you find it stimulating and, well, hopeful. How much could the NHS save, and how much happier and healthier could we be if preventing disease was our priority? Because most patients now walking through a GP's door are suffering from illnesses linked to how they live and eat. What if we could change that? Those are the big questions for this week's food programme, and what I was thinking about when I found myself in Lambeth in South London.
We're on Streatham High Road, as you can hear. It's extremely busy. There's a barber shop here. It's also a place where you can go and get your blood pressure taken, be arranged for different kinds of screening, and Dr Chi-Chi is out there with some of her team.
Hiya! Welcome, welcome, welcome. Great to see you.
This is healthcare, but not as we normally know it.
Absolutely. This is how we do healthcare in Lambeth. It's exciting. We're on the ground, and you can see everybody sort of walking past with their shopping, with their children. And we're just here really helping to reach the community and engage them in their health and well-being.
Dr Chi-Chi Ekhator is an NHS GP and our guide today. She's no one's idea of a conventional GP. You're almost as likely to find her talking to her patients in Brixton Market as in her surgery. She has many roles, including being a GP appraiser for NHS England, as well as founder and lead at the A.T Beacon Project, an initiative that flips health on its head, bringing healthcare out of GP surgeries into the centre of communities. In Lambeth, they've launched 6 hubs, including the barber's shop.
Whether that's a social supermarket where we know communities will come to do their shopping because it's subsidised. These are people I'm not going to see in my surgery until they crash out in renal failure or a stroke. You know, we go to churches, we go to mosques, we go to areas where we are finding those people that we know their health is of a concern to us due to the statistics that we know. So instead of waiting for them to come to the GP surgery, to come to the clinics, to come to A&E, and cost the NHS millions. You know, I don't like to talk about cost, but cost is a real issue. Let's tackle those issues early.
The A.T Beacon Project is working with partners in Lambeth, with the council, public health organisations, voluntary groups and the NHS. Through the community hubs, the Lambeth medical team use the offer of a blood pressure check as an opportunity to build trust and have conversations about the issues that often arise from poverty and exclusion, like how to have a better diet that includes expensive fresh veg and fruit.
My name's Karen. I cut out all sugar, started cutting out all the processed food. So I just basically went back to basics and I just cooked my food from scratch. The vouchers itself has been instrumental in doing that. Every week I buy a lot more veg. Basically it's a lifestyle change, and my blood pressure has, it has gone down, and I'm hoping that it will keep going down.
Seems to be working. The Lambeth health teams don't just set up business in barber shops. They're also offering vouchers that can be exchanged for fresh fruit and vegetables. That's run in partnership with the Alexandra Rose charity, which, coincidentally, is one of the finalists in the BBC Food and Farming Awards this year. Last year, together with the public health teams in Lambeth and Tower Hamlets, they launched a pilot study prescribing fruit and veg to people with conditions linked to diet, like diabetes type 2, high blood pressure, heart and kidney problems, obesity. If such prescribing works, and the evidence so far is good, then the model could be used to change health services all over the country.
We don't spend much on prevention. We should spend more, no question about it. Why would you want somebody to develop type 2 diabetes when the evidence shows that with diet and exercise, you could prevent impaired glucose tolerance worsening to type 2 diabetes? It's just better for the patient, it's better for the NHS, it's better for everybody. But prevention is much more than what a doctor or a nurse does with a patient. It's about creating the social conditions for good health.
Producer Sophie, Anton and I spent 2 days following Dr Chi-Chi and her team around Lambeth. To say they're doing healthcare differently is an understatement. We joined the team, doctors, nurses and health ambassadors, outside Levels Hair and Beauty Salon on Streatham High Road.
There's 3 members of the team. They're sort of accosting people in the street saying, would you like to come into the barber's and have your blood pressure taken?
Come in, come in. Obviously, you can see all the clientele in the barber shop. We're very comfortable here, and you can see that they're comfortable with us because we've been delivering this model of care for many, many months. We have at least 10, 12 people right now in the barber shop. Some are under the dryer, some are having their hair, wonderfully weaved, and the men are having their hair groomed. So this is a way of us bringing health to people that, personally as a GP, I may never see for decades until they develop a condition that's irreversible. We have a lot of men here, African, Caribbean backgrounds, and so it's important that we begin to engage these men and ensure that they know their risk. We know that certain ethnic minorities are increasing hypertension, so the fact that we can help them to check their blood pressure right here, right now, and they can go home with a blood pressure monitor also. We know that some of these people that we're seeing here are at increased risk of diabetes and also mental health issues. So you haven't had your blood pressure checked today because you said it's normal.
Yeah.
But
yes,
you are
yesterday.
going to have your PSA check done.
I will definitely.
We will check.
Yes.
Because I know you're coming back for another haircut in 2 weeks.
Next week.
Next week?
Every week, yes. I have
These
to.
men, they really are.
We gotta look
they
after
take care of
ourselves.
themselves outside, but inside is also really important.
Very important.
So your prostate matters.
That's good.
You will have it checked this week.
Definitely.
Well done.
Thank you very much.
Thank you. Lovely to meet you. This is Jason, who is the owner of this establishment, who has partnered with us to deliver this health initiative. He's allowed us to use his space to bring in health teams consistently every week for over 18 months now. So without the partnership with the community, this just isn't possible. And as a doctor, I've had to learn that actually sometimes to reach communities, I have to empower the important people to the community and collaborate.
What made you sign up for this? What seems a bit revolutionary? It's a barber's and it's a place where you can start to find out about your health.
To be honest, initially I was confused as to how it was going to work. But when you think about it, a lot of people can't even make time to go and see their GPs. So having something where you get a lot of people coming in and out, it does make sense. To be honest, I'm quite surprised as to how well it's doing because a lot of people are cagey, not too sure about new things being introduced into their surroundings. But it's taken quite well and it's very, very good.
Do you use it? I mean, do you check your blood pressure?
I checked a few times and then I got scared and then I stopped. Every now and then I do get it checked.
And you're reluctant to get these kind of checks?
I wouldn't say reluctant. I think people are just not sure. And so sometimes you have to kind of coach them and just say, oh no, it's all right, it's just blood pressure, nobody's taking your blood. Oh, is it? And they're here every week. Yeah, they've been here for the last year and a half. Oh, okay then, I'll get it done when I finish. You know, so sometimes it's just a bit of coaching and encouragement.
You know, you have your blood pressure checked occasionally. Has it changed your diet, your behavior, your...
It did at the early stages. How can I call myself? I've always said I'm a lion, and lions can't eat veg. But once I did get it checked, I think it was borderline, so I decided, okay, for at least a month and a half, I was going to just go on a veg diet. And I did it. After checking again, it calmed down, so I realized that it does help. You couldn't put veg on my plate, no way. But now, I can sneak one or two in.
My name is Kwame, and I'm a member of the Levels Hair and Beauty Salon.
Have you had your blood pressure done recently?
I always do my blood pressure, and I thank God I happen to have the best blood pressure in this place.
I'm glad to hear. Because men are notoriously difficult to reach, aren't they? They don't want help. Am I misspeaking? Is that correct?
It's a fact, because as men we feel so macho, so we don't feel like there's a need to check our health. But as years been going on, we see that a lot of people are passing away without having to check their health. So it's very important that men, we should stop being so masculine and just have a health check.
Having your blood pressure taken regularly, has it changed the way you eat or exercise?
It has indeed, because about 7.5 months ago I went to my doctor's and my cholesterol was a bit high. So I decided to change my diet and then increase the level of my exercise. Because I work in the barber shop, I go out there, buy crepes, buy Snickers, the odd chips. But now that I'm a married man, I get my wife to do the cookings, and then obviously then I know what's going into the food, the ingredients, rather not knowing what I'm buying from outside. So it's best to know what's going into the food before you eat it. So that's what I did to change my diet.
Do you bring a packed lunch or a...
Yeah, I bring a packed lunch here myself, yeah. And I drink plenty of water. Before I was drinking more the fizzy and the juice, which is a lot of sugar. Good diet.
Do you feel better?
Much better.
Really?
Yeah, much better. Yeah.
The barbers at Levels are, as Chi-Chi puts it, trusted faces in trusted places. Another place people trust is a community centre in the heart of the Angel Town estate, a mile north of Brixton Market.
This is very much the heart of Brixton, which has a really thriving community that has had its challenges over the years. People in Angel Town work very hard, but there are significant challenges around food insecurity, around poverty, around long-term conditions, and just around the pressures of life. They often have questions they want to ask. They want to sort of have time to have those things explained to them. But as you can hear in the background, we've got a client who is here having their blood pressure checked, and she will be able to receive her vouchers and head down to the market. So it's that holistic loop that we follow people through, from our hub to the traders, back to our hub, back to their community, making it so convenient for them and removing as many barriers as possible.
What were the barriers? Building trust in the community.
I think that communities over the years have had lots of different messaging. Communities over the years have had projects come and go. They've had promises come and go. And I think some communities remember those things. And unfortunately, that has added to the lack of trust that we're seeing. Communities have expressed their deepest needs, which is around food insecurity, is around poor housing. 36% of the residents in Lambeth live in poverty. This is stark. What we've done in Lambeth with our partners in Lambeth Public Health, with our partners in Impact on Urban Health and other key partners in the community, is to be bold and audacious and launch something that communities can immediately see the impact of this intervention. They can immediately have access to healthy, good food.
We just had to pause there while someone came in to have their blood pressure taken.
Oh, she's happy to talk to us. Would you? Yeah.
Would you be happy to talk to us?
Is this nice here?
This is very nice of you. I always find it stressful having my blood pressure taken.
Had mine taken.
And were you reassured, or?
Yeah, I'm in the yellow zone today, and because I was in the red zone. They've upped my blood pressure tablets, and if it wasn't for here, I would never have known.
When you got this rather alarming blood pressure reading, what did they say?
They said, are you eating the correct food and everything? Are you going through anything different from the previous week? Reiterated the fact that you need to eat healthily, as well as, do exercises and stuff to keep the blood pressure down.
So have you changed your diet? Have you changed your activities?
Again, I can get the ground provisions because we West Indians, we eat certain different foods. So I can get the yam and bananas and, fresh fruits and that because I've got the voucher for me and my family. And that's made a huge difference. And I've lost weight as well.
Really?
Yeah. Well, I'll get the vouchers so I can buy these items that were unaffordable before because they're very expensive.
So we see a lot of people with undiagnosed or uncontrolled hypertension, especially within African and Caribbean communities. I'll describe it how I usually tell my patients. So high blood pressure, it's really the pressure within the system. We don't want the heart to be under too much pressure because it's having to work harder to push blood around the body. Now, the things that make it work harder are things that, for instance, clog up the arteries like fat. Pressure builds up over time. You're not immediately going to feel any difference. And that's why we call it a silent killer. And then ultimately, you are at an increased risk of what we call strokes and heart attacks. And also there's an impact on your kidneys as well. But actually these days we're seeing many more people who are in their 30s who have heart conditions, 40 heart conditions. It's because they're walking around having not engaged in their health matters. And actually a lot of it comes down back to all the things Sir Michael Marmot has been saying. These communities are poor and they have significant barriers because of their socio-economic factors. I'm hoping what you can see today is that health is not about Dr. Chi-Chi sitting here and prescribing medicine. 5% of health is down to doctors. The rest is due to social determinants of health, housing, education.
Food seems central to that.
Central, completely central.
How much do you think the takeover of, what is it now, 54% of the UK diet is ultra-processed?
I think that just speaks volumes about what is cheapest, what is available. That's been a theme that everybody's talking about today, that their money just isn't stretching that much further. They want to engage in their health. They want to be able to go and purchase fruits and vegetables at affordable prices. These are messages we just need to take back to the powers that be. Just subsidise something for somebody. Surely we need to do what we can to take that pressure off. If you don't pay now, you will pay in the social care budget later.
Another hub is the community shop in West Norwood, where people shop for subsidised goods, pick up their fruit and veg vouchers, and if they want, get their blood pressure checked and talk about any health concerns with Dr. Chi-Chi's team. We talked to some of the shoppers as they made their way home.
Hi, I'm Arlette and I live in Lambeth. Yeah, the vouchers are very, very useful, but what I realize now is that the cost of living is getting higher and worse. Yeah, because before with the voucher, with £10, £14, I could buy a lot of fruit and veg, but now, no.
You've just come off a night shift.
Yeah.
Have your wages kept up with the rise in the cost of living?
I still earn the same money.
So life is difficult.
Yeah, it's difficult. Yeah.
My name is Diane. Someone like me with the diabetes, high bloods, other medical complications in my family. Most of the time we feel reluctant to go to the GP for the checkup, but when we come to the shop, they take our blood pressure, at least it helps us. Then the voucher just boosts everything up because at times when you have that stress, regarding our medication, someone like me, I'm on the blood pressure pills. So I was having 2 tablets before. So they've brought it down to 1. Trust me, it's due to what I've been collecting. So I just want to thank the team so much because they've done a great job. Yes, a great job.
When you hear the feedback, it makes it all worth it. All the ups and downs, just to hear the community voice and to see the impact on individuals. I grew up in Streatham, I grew up in Lambeth, I get it. And unfortunately, the health inequalities are widening.
It's so radical and it's so simple. And you think, yes, it is. But, in a world where, I don't know, half, 3/4 of your patients are dealing with chronic disease, that this should be so radical. What about other GPs? Do you get support from them?
I think that there is a movement around lifestyle medicine. And I think this is nothing new that we're doing.
the evidence is there. So I think most GPs will definitely back this up. I know there are other budgetary priorities, but just as we've seen the social prescribing movement literally change the landscape of primary care, I think we need to take more bolder steps. But we need to be empowered to make a difference in tangible ways.
After picking up their vouchers, people spend them at fruit and vegetable market stalls in Brixton or West Norwood. The money handed out in Lambeth is spent in Lambeth.
This is Tracy. We're on Electric Avenue introducing our fruit and vegetable Tracy stall. It is an absolute fantastic scheme. All the kids are willing to want to know what it is, what it's going to do, from even the adults. They give us recipes, we give them recipes. There's not one thing I can fault about it at all. If anything, I just hope it keeps going for as long as it possibly can. It's brilliant.
What made you get involved with it?
We were one of the first traders to get involved in it. Obviously, it was more about taking a little bit of power back from the supermarkets and getting people back into a market and getting a community feeling again. It's like you take the heart out when you take a community away from things. Yeah. And children need to learn what a community is, and adults, it's an amazing thing. Yeah.
The fruit and vegetable on prescription pilot scheme in Lambeth was funded for a year through the public health budget. Around 50 people are in the trial, all with chronic conditions. They get vouchers worth £8 per week, plus £2 for each additional household member. Chi-Chi says they're already seeing positive impact on clients at risk of heart problems. I met public health consultant Dr Bimpi Oki and councillor Jim Dixon, cabinet member for Healthier Communities in Lambeth, to hear how the pilot might be expanded.
Yeah, we're strongly in favour of it on public health grounds, on prevention grounds. It's a great early intervention as people are getting iller, to try and reverse some of that trend that people experience as a result of poverty and exclusion from the health system. But it's also great for the local economy. I'd love to see us able to expand it, to really try and reverse what the wider economy is doing to people by actually doing things that people want to do rather than actually having to force upon people things that they're resistant to. Our cost of living work in Lambeth has been giving people cash who are feeling the squeeze of the cost of living, and I'd love to be able to do this voucher work across a much wider swathe of the population, and we're certainly going to look at whether there's the budget there to do it. But as simply a public health intervention, I think it's been a great success.
Dr Ricky, you've brought the cookbook that you were one of a team putting this together. Tell us about it.
So here's the cookbook, Healthy Eating and Recipes to Support Black Communities' Health in Lambeth. So quite often we have heard from these communities that when they are given advice around their diets in particular, it doesn't always resonate with them, because perhaps the healthcare professional they're engaged with doesn't fully appreciate the breadth of their diet. I think there's also a perception that only certain diets are healthy. And so people have struggled in terms of their own cultural diets, often thinking actually they're not healthy. So what we've tried to do is actually to bring together some advice in a recipe book. So I've opened the page on ackee and saltfish. Just from the name, it's quite a salty dish. And so we've provided some practical tips, like making sure that they can soak it in water for a while so the salt comes out. So we've had 4 or 5 editions because it's been extremely popular. Actually, a lot of our London boroughs have asked us for copies of this, but I think it's also good when you're talking to someone about their diet and you can actually give them something to take away. It gives them that confidence, they can try things out, it's practical. We hope that it's actually making the impact that it can make in terms of people's health and well-being.
What do you hope for the future of this project, but also this way of approaching health, this preventative approach?
So I really hope that we can scale this up. I think we've tested it, we see that it works, and we need to look at ways in which we can really spread this out.
We're something like the 7th largest borough in London with 320,000 people, and it's really important actually that we tackle health at the grassroots. So we now have a big health inequalities fund approaching £1 million. We find it both from our public health budget but also working with the 6 other boroughs through the South East London integrated care system, which is our new health arrangement. They are being enlightened in helping us invest in health inequalities funding. And so our budget of nearly £1 million is spent with a variety of grassroots organisations, voluntary and community sector organisations across the borough on schemes such as this. And it's something that the data tells us is really starting to bear fruit. And so we're going to try to find ways of liberating parts of our budget to do more of it because it makes sense in the long term.
Councillor Jim Dixon and Dr Bimpy Oki from Lambeth Council. Jim mentioned the recently formed integrated care systems. They've been called the biggest legislative overhaul of the NHS in a decade, essentially forcing the NHS, local authorities, voluntary sector, hospitals and so on, to work together to deliver services that tackle health inequality, building on lessons from the pandemic, and make better use of public money. The reality, of course, is that public money is in short supply. But the partnerships and innovative thinking in Lambeth provide one model of how to negotiate a lot of hurdles. Finding ways to reduce health inequalities between different groups has been the life work of Professor Sir Michael Marmot, Director of the Institute of Health Equity at University College London. His government-commissioned study, the Marmot Review, set out in 2010 what was necessary to make Britain a healthier, fairer place. But figures now show that over the last decade, improvements in health in the UK slowed dramatically. Could the new integrated care systems legislation turn things around?
It doesn't automatically mean a shift to more prevention, but it provides the possibility for that to happen. But it's got to be an act of will to make it happen. But there's an integrated health care system that's actively trying to work on the social determinants of health to prevent illness occurring in the first place and to reduce inequalities. And so I'm hopeful that this change provides a real possibility, but it won't happen without conscious effort. ICSs can move in the right direction. It can't deal with these other social determinants that are affecting people's lives. Inadequate, low-quality housing. It can't deal necessarily with poorly paid jobs. It can't deal with the cost of childcare. That takes action, ideally from central government, but if they're not prepared to do it, at the very least from city and local or borough government, bottom up or top down. We need both. Absolutely vital.
Professor Sir Michael Marmot. Let's finish back with Dr Chi-Chi Ekhator over a cup of tea at the end of a long day in a cafe not far from the fabulous Barbers.
In a time when it just seems there's just endlessly bad news about the NHS, suddenly we've been plunged in this day and a half into something that works, that seems full of hope. It just does seem remarkable.
Absolutely. I think it's really exciting. We've had inquiries locally and also nationally because we're beginning to see that we need to find other solutions and we're beginning to recognise that we do need to do health differently. So it's important that we take health to people as they strive just to live. So we've got to find where they are. And as you can see on Streatham High Road, alone in the barbershop, those are 1,000 lives that we've been able to touch every month. But as long as we have hope, there are solutions. And we are hopeful that the NHS will continue to be that world-renowned institution that it has been over the last 75 years. And I think the world keeps on talking about the NHS and we need to be proud of what we've got. But there is a future and I'm part of that future.
On Wednesday, we're celebrating and we'd like you to join us in Newport, South Wales. Just put BBC Food and Farming Awards into your search engine to get free tickets. Simple.
This message is brought to you by Maker's Mark. Maker's believes in celebrating the people who have inspired us to pursue our passions. And now, thanks to the Maker's Mark personalized label program, you can create a custom label to celebrate those special loved ones with their own unique Maker's Mark label. And best of all, the label program is free. Go to makersmarkpersonalized.com to order your personalized label today. Must be 21 or older. Labels currently available for 750 milliliter bottles only. Bottles must be purchased separately. Maker's Mark makes their bourbon carefully, so please enjoy it that way. Maker's Mark Kentucky Straight Bourbon Whiskey, 45% alcohol by volume. Copyright 2023 Maker's Mark Distillery Incorporated, Loretto, Kentucky.
This ACAST podcast is sponsored by NetSuite. 36,000, the number of businesses which have upgraded to the #1 cloud financial system, NetSuite by Oracle. 25. NetSuite just turned 25. That's 25 years of helping businesses streamline their finances and reduce costs. 1. Because your unique business deserves a customized solution, and that's NetSuite. Learn more when you download NetSuite's popular Key Performance Indicators checklist, absolutely free, at netsuite.com/ACAST. That's netsuite.com/ACAST.